Meanwhile, the COVID case count is continuing its upswing. More than 1,000 new cases in BC in the past 3 days, more than half of them in the Interior Health region. There are 1,079 new cases over the past 3 days and 5 new deaths. Of the new cases, 587 are in Interior Health, 258 in Fraser Health, 142 in the Vancouver Coastal Health region. 62 cases are coming from the island and 30 in the Northern Health region. The number of patients in hospital has grown slightly to 68, with 20 of those in intensive care. While in the hopes of reducing those numbers at outbreaks right across the province, the government is now slashing the interval between vaccines. British Columbians can now get their second shot after 28 days, but BC's top doctor is still advising if you can wait longer, you should. CTV's Binder Sudjan explains why.
At a pop-up clinic at the Vancouver Art Gallery, you can walk up, get the jab, and get vaccinated.
We're really hoping to get people as they're walking by. You know, downtown Vancouver's a busy place, lots of foot traffic.
All clinics in the province will now accept walk-ins for first doses.
We're seeing a great uptake for people coming for their first doses. I really think what we're seeing is that the convenience is really speaking to people who've got busy lives, who haven't been able to make an appointment, who maybe are struggling with the booking system.
To make it even easier, you can now get your second shot of COVID-19 vaccine after just 28 days. Even though you can get it, experts say the science hasn't changed. Waiting longer gives you better protection. So if you're not in a hot spot, you can wait.
In general, we know that for vaccinations, when you give the prime dose and then the booster dose, once you have that initial prime dose given, you start building up an antibody response. And then that antibody level slowly goes down over time. It doesn't just drop immediately at the 4-week mark or, 8-week or 16-week mark.
Officials are chopping the interval in half to deter the spread of cases. Immunization is the single biggest factor in current transmissions. The vast majority of people getting COVID-19 now are under 40 in the central Okanagan and under or unvaccinated.
So 7 months ago, when the vaccines were first come into play here in Canada, people were like, I'm going to wait and see. I'm going to wait and see what happens to everybody else. And now we've had that test of time.
Since the Vax for BC campaign started 12 days ago, more than 70,000 people have received their first dose of vaccine. At that pace, it would take several months for everyone eligible to get their first shot. Now, Dr. Bonnie Henry says that studies are showing even a small increase in immunizations can have a big effect on the spread of the virus. Binder Sudjan, CTV News, Victoria.